One of our areas of interest is something called sleep apnea, and a dentist is somebody that's well positioned to see this. So the way that the process works with sleep apnea is that we would initially just ask a couple of questions to see whether or not you actually have sleep apnea or whether you're just snoring. And snoring and sleep apnea are a little different. They're not necessarily exactly the same thing. Now, most people with sleep apnea, they snore as well, or they completely stop breathing. If we suspected that you did have sleep apnea, we would send you on to a sleep physician and they would do a sleep test. And if that sleep test shows that you're actually stopping to breathe at night, or if you're having some kind of respiratory incidents when you sleep, that means either stopping to breathe or not breathing well, that is something that then needs to really be addressed because it can lead to a lot more serious systemic conditions. What we do, our piece of the puzzle, is that we make a little oral appliance which opens up your bite and draws your jaw forward a little bit and opens up your airway. So when you sleep at night, you're able to breathe. And these work very well in people that have mild to moderate sleep apnea cases. A lack of sleep, which happens being woken up the whole night, just generally adds to your basic stress level. It means you spend the day walking around exhausted. And there's been a lot of links to a lack of sleep and cardiovascular disease. The issues of stroke go up very, very high. There's high correlation between people with sleep apnea and stroke events in patients. From what patients have told me, whether it's a CPAP machine or an oral appliance, it's literally transformed their lives. They just have amazing sleep. They wake up the next day, they feel refreshed. And I think, high energy levels. And besides all the medical issues that it helps with, I think that alone, just waking up in the morning and feeling rested and having your stress levels reduced, is amazing.